Hello viewers, my name is Gary Onopite. My topic of discussion today is diabetes mellitus, part of all that I've been discussing about health and wellness. So, diabetes mellitus, I'll first be discussing about diabetes mellitus 1. What is diabetes mellitus 1 or type 1 diabetes? This type 1 diabetes is a diabetes that is most prevalent in young children and also young adults. It can be defined as an autoimmune disease or condition in which the body immune system destroys the cells in the pancreas that produces insulin, known as beta cells. That is how it can be defined. Insulin happens to be the hormone that helps move sugar or glucose into human body's tissues. The cells in the body uses insulin as fuel and also uses it to produce energy in the body. So what roles does insulin play in the body? Insulin is a hormone that can be found beyond the pancreas or below the pancreas. The pancreas secretes insulin into the bloodstream. Insulin revolves all around the body, thereby causing sugar to spread or enter into the cells. Insulin also lowers the amount of sugar in our bloodstream. As your blood sugar level drops in your bloodstream, likewise does the secretion of insulin drops from your pancreas. That is how it works. So when the pancreas malfunction, due to the unavailability of insulin to let glucose into the cells, sugar builds up in your bloodstream. In most cases, it is life-threatening when this occurs. As a result of this malfunction, the cells starve. That means they don't have feeds or anything feeding them with sugar, thereby causing high blood sugar in the bloodstream, which can lead to situations like urinating frequently as a way of getting rid of sugar in the blood, causing your body to dry out. Another frequent signs or symptoms that normally happens is weight loss. Such a person begins to get thinner and thinner. This happens when you pee or urinate. The glucose that leaves your body takes along calories with it, the calories that are found in the body, thereby causing you to lose weight, followed by dehydration. So the person becomes dehydrated, as if there is no fluid in the body or water. So whereby your body will be lacking enough water. That is what actually happens. There also happens to be what is called diabetic ketoacidosis. This happens as a result of your body not having enough glucose for fuel, causing your body to break down fat instead of because of the unavailability of glucose. That is what happens. Your body breaks down fat because there is no availability of glucose to supply to all the parts of the body to feed the cells. As a result, the chemical that is called ketones is produced because of no supply of sugar to the cells. So the liver in your body tries to help out by producing the sugar it has stored up. But your body can't use it without insulin. So it builds up in your blood along with acidic ketones. So ketoacidosis, which is the combination of extra glucose, dehydration, and acid buildup, can be life-threatening if not treated on time or immediately. Another sign that develops due to lack of insulin is damages to your body, in which high glucose levels in your blood harm the nerves and small blood vessels in your eyes, kidneys, and heart. These also lead to hardening of the arteries or atherosclerosis, which can lead to heart attacks and strokes. Causes of diabetes mellitus 1. Today, there is no known cause for this disease yet. Most likely known cause is autoimmune disease, a condition in which the immune system attacks and destroys healthy body tissues in the body. Another likely cause could be an infection or another trigger which causes the body to mistakenly attack the cells in the pancreas that make insulin or produce insulin. Another factor may be a family history. Anyone who has a parent or sibling with type 1 diabetes has a slightly increased risk of developing the condition. Also, the prevalence of certain genes indicates an increased risk of developing the type 1 diabetes. Complications of diabetes. The complications of diabetes may be life-threatening and disabling. They include heart and blood vessel disease, which is diabetes increases your risk of various cardiovascular diseases such as coronary artery diseases with chest pain, heart attack, stroke, narrowing of the arteries, and high blood pressure. Nerve damage known as neuropathy, high sugar level can injure the walls of the tiny blood vessels that nourish or feed your nerves in the body system. This happens especially in the legs, whereby you lose all sense of feeling in the affected limbs. So instead of having feelings of affection on your legs, on the limbs, you will not be feeling any effect. This happens as one of the complications of diabetes mellitus 1. So there happens to be damage to the nerves that affect the gastrointestinal tract, which can result to problems like nausea, feeling sick, vomiting, diarrhea, or constipation. For men, it can lead to erectile dysfunction, whereby a man can become impotent. This is one of the symptoms of diabetes mellitus 1. It can lead to that. There is also kidney damage known as nephropathy. The kidneys filter waste materials from the blood. So diabetes can damage this delicate filtering system in the kidney, thereby leading to severe kidney failure or irreversible kidney disease, which may likely need a kidney transplant. These are some of the areas in which diabetes mellitus 1 leads to. Another complications that diabetes mellitus 1 also lead to is eye damage. Diabetes can damage the blood vessels of the retina, which can potentially cause blindness such as cataracts and glaucoma. Another complication is foot damage. Due to nerve damage in the feet or poor circulation of blood to the feet may lead to foot complications such as cuts and blisters that can become serious infections requiring untimely foot, toe, or leg amputation. Then you also have something else known as diabetic foot ulcer. Skin and mouth conditions. The diabetes may lead you to more susceptible infection of the skin and mouth, which includes bacterial and fungal infections, gum disease, and dry mouth, affecting the gums in the mouth and also the mouth itself. Another complication is pregnancy. High blood sugar levels can also lead a pregnant woman to miscarriages, stillbirths, and birth defect, especially when diabetes is not well controlled. For the pregnant woman, it also increases the risk of diabetic ketoacidosis, diabetic eye problems, retinopathy, pregnancy-induced high blood pressure, and also pregnancy characterized by hypertension and fluid retention. All these are complications of diabetes mellitus 1. Signs and symptoms of type 1 diabetes mellitus. They include being very thirsty. You feel very thirsty, feel like drinking water all the time or drinking something. Feeling hungry, you always feel like eating. Feeling tired all the time, having fatigue, having blurry vision, not seeing very clearly, feeling numbness or tingling in your feet as if there's no life in the feet or under the feet. Weight loss for no reason. You just lose weight after being in a modest weight. You loses your weight to become thin. What are other symptoms? They include urinating frequently, urinating up to 10 times or more a day. While for others, the onset of diabetes mellitus 1 could be symptoms like deep, rapid breathing. You breathe so fast, dry skin and mouth, flushed face, fruity breath odor, and nausea or vomiting, inability to keep down fluids, and also having stomach pain. These are some of the symptoms of diabetes mellitus 1 as explained. What are the diagnosis and tests of diabetes mellitus 1? A fasting blood sugar glucose test. Measure your blood glucose level after 8 hours of fasting without food or drink. Only what could be taken is water. This test is not always reliable. It tends to be more accurate in the morning. It is especially required to conduct multiple tests at separate intervals for a diabetes diagnosis. Oral glucose tolerance tests. If your initial fasting blood glucose test result is normal, but you have some symptoms or risk factors for diabetes, this test is used to diagnose or find out. Also, the glycated hemoglobin test or AIC test is another test for diabetes mellitus 1. This test provides an overview of your blood glucose levels for the past few months rather than just a fast snapshot of your current level. It measures the percentage of blood sugar attached to the oxygen-carrying protein in red blood cells known as hemoglobin. The higher your blood sugar levels, the more hemoglobin you will have with sugar attached. An AIC level of 6.5% or higher in 2 separate tests indicates that you are having diabetes mellitus 1. Treatments and medications. Type 1 diabetes occurs because of lack or insufficient production of insulin. So this means you will need to require insulin treatment to keep your glucose level normal all the time. So people who are having type 1 diabetes requires a lifelong treatment or injection of insulin treatment. Lifelong, continually, all through the lifespan of such individual. There are different types of insulin. Your doctor may be qualified to determine which one will be more effective for you. So there are other treatments or ways of preventing diabetes mellitus 1. These are some of the ways. Immunotherapy. You prevent the onset or progression of autoimmune destruction of insulin-producing beta cells by blocking the destructive T cells. Support regulatory cells which protect against autoimmunity. You can do that by scheduling a yearly physical exam and regular eye exams. You do this regularly. And you also keep your vaccinations up to date. You take your medicines regularly. High blood pressure can weaken your immune system, so your doctor will likely recommend the pneumonia vaccine as well, so as not to bring rise of high blood pressure. Then you also have to pay attention to your feet. Wash your feet daily in lukewarm water and dry them gently between the toes. Apply moisturizer on your feet every day for blisters, cuts, sores, redness, or swelling. If possible, consult your doctor if you have a sore or other foot problem that doesn't heal. It is very important you consult your doctor when you find such a symptom on your feet. Keep your blood pressure and cholesterol under control. So you make sure you do blood pressure checkup regularly, and also you don't eat too much fatty foods. If you smoke or uses other types of tobacco, you have to quit immediately or seek professional assistance from your doctor to quit. This is important because smoking increases your risk of diabetes complications, including heart attack, stroke, nerve damage, and kidney disease. If you drink alcohol, do so responsibly. Don't drink and overdrunk. Alcohol can cause either high or low blood sugar depending on the amount you consume. So it is very important you take to that effect. You make sure your consumption of alcohol is moderate. And you also have to take stress seriously. The hormones your body produces in response to prolonged stress may alter or prevent insulin from working properly, which can stress and frustrate you the more. So you have to avoid stressful jobs or stressful occupations. Monitoring blood glucose levels by checking your glucose multiple times every day with glucose meters. So you have to have a glucose meter on hand with you to be checking your glucose level every day if possible. Then you have to eat a well-balanced diet and monitoring carbohydrate intake, because carbohydrate greatly affects blood glucose levels. So your intake of carbohydrate should not be much, it should be moderate, and you have to always monitor it. Then lastly, you have to exercise regularly, which can lower blood glucose and increase the body's sensitivity to insulin. So exercise also helps in helping the production of insulin in the blood. So that is type 1 diabetes, known as diabetes mellitus 1. For further discussion about health and wellness, you are still going to hear of diabetes mellitus 2 in the following video.